Namaskar. Myself Dr. Namrata Joshi. I am professor and head of the department Rasa Shastra in Faculty of Ayurveda, Institute of Medical Sciences, Banaras Hindu University. Today I am going to give a lecture on skin care in chronic wound and bed sore. So, before moving on to the topic, let us first give a brief introduction about what skin is all about. We all know that the skin is made up of three layers: epidermis, dermis and hypodermis, and epidermis is further divided into 5 further layers. The epidermis is the protective covering, the outer covering of the body, whereas dermis is the next to epidermis, which contains the blood vessels as well as the nerves. The hypodermis is again beneath the dermis and it provides a fatty, soft cushion to the organ. Now, when we talk about the skin diseases, if we talk in general about the Ayurveda, in Ayurveda, the skin diseases, all skin diseases comes under Kushta Roga. Kushta is not leprosy but the skin diseases in Ayurveda, and these Kushta are divided into 2 categories. First is Shudra Kushta and next is Mahakushta. The clinical symptoms of Mahakushta is as similar to the leprosy, whereas Ekadash Kushta, Shudra Kushta contains all the other skin ailments like eczema, seborrheic dermatitis, psoriasis and all others. So, before going through the pathophysiology of the skin diseases, let us first know how skin diseases happen. For any skin disease to happen, there is dermal inflammation or dermal hyperplasia, dermal hyperkeratosis, dermal melanin incontinence. So, first, what is inflammation? Inflammation means if we are hurt at any place, in that place जिस जगह हमें चोट लगती है वहाँ पे कुछ सूजन हो जाती है, कुछ लालिमा आ जाती है, वहाँ दर्द होता है और वहाँ हम काम नहीं कर पाते हैं. तो उस जगह में क्या होता है? दिस इज द डिफेंसिव एक्टिविटी ऑफ द बॉडी एंड जो डिफेंसिव सेल्स ऑफ आवर बॉडी दैट गेट accumulated at that area and certain mediators of inflammation get accumulated in that area to cause the inflammation as a defensive mechanism to heal it. So, such an inflammation can causes cell infiltration pathology and causes certain skin diseases like eczema, seborrheic dermatitis, psoriasis and others. If we want to treat the epidermal or dermal inflammation, we have to control the inflammation. Similarly, the second situation is hyperplasia. Hyperplasia is abnormal increase in the number of cells. And what happens in case of skin, the sebaceous oil glands, they make too much of oil and clogging happens in that area. So, it can be corrected if we modulate the lipid biosynthesis. Similarly, in hyperkeratosis, there is a thickening of the keratin layer and it's seen in the chronic eczema, corns and in calluses formation, etc. In this case, for the treatment modalities are given in such a way that increases the content of water in the skin and also soften that area. The last one is the melanin incontinence. It can be hypopigmentation or hyperpigmentation which damages the basal cell and it can be corrected by balancing the melanin secretion. When we talk about any chronic wound, in any chronic wound, what happens? There is a persistent inflammation. Because of persistent inflammation, there is a higher concentration of inflammatory cells as compared to acute wound. Say, for an example, किसी जगह में कहीं चोट लगी है और उसी जगह में बारंबार जिस कारण से चोट लगी है वो अफेक्शन होता रहेगा, तो वहाँ पे जो हीलिंग प्रोसेस के लिए जो बॉडी में डिफेंस सिस्टम काम कर रहा था वो नहीं कर पाएगा. बिकॉज ऑफ दैट देयर इज अ हायर कंसंट्रेशन ऑफ द mediators of inflammation and as compared to the acute wound. Further, because of that there is an impaired angiogenesis. व्हाट इज एंजियोजेनेसिस? जैसे मैंने पहले बताया था, एक्यूट इन्फ्लामेशन में हमारा क्या होता है कि ब्लड लालिमा आ जाती है क्योंकि वहां पे ब्लड वेसल्स बहुत ज्यादा डायलेट कर जाती है। बट इन द केस ऑफ द क्रॉनिक वुंड, वहां पे जो एंजियोजेनेसिस की जो न्यू ब्लड वेसल फॉर्मेशन होता है वो कर्टेल हो जाता है, जिससे कि हमारा जो रूटीन वुंड हीलिंग होता है दैट इज नॉट प्रॉपरली गवर्न। सिमिलरली देयर इज ऑल्सो इंक्रीज इन द enzyme called proteases. These proteases enzymes, when it gets increased in the chronic wound, it contributes to the tissue damage and thus hinders the healing. Furthermore, there is also deficiency of stem cells. Stem cells are necessary for the regeneration of the new tissue, but in the chronic wound, due to deficiency of stem cell, regeneration process is further delayed. Similarly, there is damage of senescent cells. These cells are metabolically they are active, but they are in the stoppage of the natural cell cycle. But in this in chronic wound, they get damaged and ultimately they accumulate in the wound, contributing to the new non-healing environment. Further, excessive scarring and collagen deposition can lead to the thickening and inflexible scar, which does not allow the proper tissue function. In Ayurveda, for chronic wounds, some symptoms have been advocated, like it is slow healing, it has persistent pain, it has paresthesia, means numbness. Apart from that, throbbing pain, pallor and swelling. Throbbing pain means सुई की तरह चुभने की फीलिंग को होना. In Ayurveda, if we talk about any wound treatment, we consider the smell of the wound as well as the अधिष्ठान, कहाँ पे वो wound है, and the स्राव, उस wound से किस तरह का स्राव डिस्चार्ज हो रहा है. तो वेरी फर्स्ट थिंग, गंध ऑफ द वुंड, वुंड में से किस तरह की स्मेल आ रही है, अकॉर्डिंगली उसका ट्रीटमेंट किया जाता है. तो अगर किसी वुंड में से घी की तरह की स्मेल आ रही है तो इट इज कंसिडर्ड दैट वी हैव टू ट्रीट द कोस्ट. बेसिकली इन आयुर्वेदा, whenever we talk about the treatment, we consider the stage of dosha, whether it is a kost ashrit or shakha ashrit or marm asti sandhi ashrit. In case if the smell is ghee, that means the doshas are, we have to check the cost. Similarly, and accordingly we have to do the treatment. In case if it smells like the fat or the pus, then it can be considered that the uttana dhatu means ras, rakt, mans, med dhatu are involved. If it is rakt, putrid smelling or like shower gandh, then it is considered as it is treated in the deep rooted wound. And gambhir dhatu, asti, majja, shukra are involved. Similarly, if the gandh of the wound is amla, putik is unpleasant smell, then it is considered as marm or affection of the vital part. Such wounds which are involved in the deeper tissue, gambhir dhatu or the marm stan, that are very difficult to cure. Again, according to srav, there are 14 types of srav I have been mentioned, like puya srav. Puya means pus-like, asrik, blood-like, arun, red in color, haridra, yellow in color, and such srav are seen when there is a involvement of uttana dhatu. Again, pinjar is white, thick, slimy, kashai, yellow or brown, neel, harit, that means gambhir dhatu involvement. Again, if marmasti sandhi is involved, the srav will be snigdha ruksha, sit or asit. Similarly, if the coast is involved, it is lasika, lymph vessel like, and jalvat स्राव is there. According to स्थान, कहाँ पर वुंड है, उसके अकॉर्डिंग उत्तान धातु इन्वॉल्वमेंट होगा तो मांस और मेद का इन्वॉल्वमेंट होगा. अस्थि स्नायु तो गंभीर धातु, मर्म में होगा तो मर्मास्थि संधि, और त्वक शिरा में होगा तो कोष्ठ. Now, if we talk about the management of chronic wound in Ayurveda, for this, according to symptom, if the patient is having the severe pain, what we can use? We can wash it with the Yashti Madhu Grita or a Bala tel. Similarly, we can sprinkle the medicated oil and can do the local Svedana or apply certain medicated paste like the Shangalep. Snehvasti can also be indicated in such cases. To mitigate the heat of the wound, the drug means if there is a, in that case, the drugs which are astringent in taste and cold in potency can be advocated. For traumatic wound, honey and grita should be used. Again, for any wound, there may be vata imbalance, there may be pitta imbalance, there may be kapha imbalance. So, how we can know that there is a vata imbalance? If it is leading to pain and swelling, there is a vata imbalance. If it is leading to burning sensation and infection of blood and ulceration, there is a pitta imbalance. If there is a accumulation and vitiation of the fluid, it is a kapha imbalance. Now, for treatment in Ayurveda, in the Sushruta Samhita, basically 7 upakrams are mentioned first, and those 7 upakrams are again divided into Shashti upakram, 60 upakramas. So, first 7 upakramas are Ado Vimalapan Kuryad, Dvitiyam tu Avasetinam. So, सबसे पहले Vimalapan. Vimalapan means softening of the wound. Means to remove the debris from the wound, it is called Vimalapan, and it can be done with a certain or medicated oil like Murivanna oil, like Jatyadi Grita, like Jatyadi Tel. After Vimalapana, next stage is a Avasechanan. Avasechanan means to expel out the doshas. After Avasechanan is a Visravan. Avasechanan and Visravan. In Avsechan we are expelling the dosha, in Visravan also we are expelling the dosha. But Avsechan may, the mode of expelling the dosha may be not only the bloodletting, it may be even Virechan also. But in Visravan specifically only bloodletting is done. In Ayurveda, for bloodletting we also use leech hirudinaria, because the hirudin species have the specific quality that once it sucks us, it only sucks the impure blood, leaving behind the pure blood. And through the impure blood, the disease toxin can be removed. After Visravana, Snehpana, oleation therapy, then Vamana, therapeutic emesis, and lastly, therapeutic purgation Virechan may be advocated. These 7 upakramas of wound are further bifurcated into 60 treatment for chronic wounds. Out of these 60 procedures, some procedures have been mentioned which are very frequently used are, number 1 is Alep, to apply some paste. Application of paste is called Alep. Second is Parishek. Parishek means pouring of medicated juices or quath etc. that called the Parishek. Because of Parishek, the local blood circulation increases and thus helps in the healing. Next is the Abhyang. Abhyang is gentle massage. Massage can be done again with the certain medicated oil like Jatyadi Tel, Jatyadi Grit etc. Next is the Asian curve. Asian is probing. If there are certain sinuses, means some spaces are there and certain wounds are formed within those sinuses, that can be treated with the help of the Asian curve. Pedan. Pedan means squeezing, like squeezing of the pasa. Next is Lekhan. Lekhan means scraping. Scraping means if something, some debris have been accumulated or some sort of any granthi or any gath ya koi bhi tumor like structure have been formed, that can be scrapped with the help of Sandhav Laban or Samudra Fen, etc. For severe pain, we can use Svedana. Svedana is nothing but the fermentation. After that, Apatarpana. Apatarpana is a type of fasting. In Ayurveda, for every disorder, Am Utpatti is mentioned, and for the treatment of Am, Apatarpana is one of the best measures. Apart from that, Dhupana Karma. Dhupana Karma is fumigation. Fumigation by means of even Gugulu we can use, and Gugulu is one of the best antimicrobial drug. Similarly, Krishna Karma. Krishna Karma means like we must have many of us must have encountered that after burn the skin becomes white. White patches happen. To treat those white patches, there is a treatment modality called the Krishna Karma, and in that Krishna Karma, Bhallatak oil with the Khura Bhasma has been mentioned. Similarly, Pandu Karma. Pandu Karma मतलब किसी चीज को सफेद करना, काले को सफेद करना. For that, रोहिणी fruit are nothing but the हरड़ के फलों को गाय के मिल्क में भिगो करके उसको पीस के लगाने का प्रोविजन बताया गया है. Similarly, Sivan Karma is nothing but the suturing. Shodhana Karma is a purification by using the different decoction. And last is Avachurnan, means sprinkling of certain medicated powders. Now, Dushtavran. What is Dushtavran? When a wound is not healed within a week, it is termed as chronic wound. For chronic wound, apart from the local application, local treatment, oral treatment has also to be given. For internal therapy, Vamana, therapeutic emesis to detoxify the body, Virechana, therapeutic purgation to eliminate the toxins, Langhana, fasting to reduce the inflammation and improvement of the digestion, and certain dietetic regimen are recommended. Again, for Dushtavran, chronic wound, certain external therapy like जलों का अवचारण, जैसे मैंने पहले बताया था कि लीचेस को हम लगाते हैं और लीचेस हैव गॉट द स्पेसिफिक क्वालिटी कि दे ओनली सक्स द बैड ब्लड. जो प्योर ब्लड को वो नहीं लेती है, इम्प्योर ब्लड को ही वो अपने अंदर सक करती है. तो ब्लड लेटिंग कैन बी डन विद द हेल्प ऑफ द मेडिसिनल लीचेस to remove the stagnant blood and to reduce the inflammation. Apart from that, Vrana Prakshalan, washing of the blood, of the wound. In Ayurveda, certain kashayas, specifically Panchavalkal Kashaya. Panchavalkal Kashaya में 5 बड़े-बड़े जो ट्रीज होते हैं, वट वगैरह कई तरह के 5 ट्रीज होते हैं, उनकी छालों के काढ़े से वुंड को धोया जाता है. इस तरह के जो पंचवल्कल कषाय है, नॉट ओनली रूटीन आपको वुंड धोने के काम आता है, बल्कि गायनेकोलॉजिकल डिसऑर्डर्स में भी कई बार आपका जब वजाइनल प्रॉब्लम्स फीमेल्स को होती है, इन दैट केस आल्सो पंचवल्कल douching is applied. Similarly, certain lepas are also indicated, like the Shanga lep for the healing purpose. Similarly, certain oils like Murivanna tel, like Jatyadi tails are advocated in the cases of Dushta Vrad. Certain herbal and mineral formulation for the treatment of Dushta Vrad include Triphala. Triphala is best known for its anti-inflammatory and wound healing properties. Similarly, Panchavalkal is also having the antiseptic and wound healing properties. Neem oil. Neem contains nimbidine, one of the phytoconstituent that is known for its antibacterial and anti-inflammatory activities. Similarly, Haridra. Haridra is best known for its anti-inflammatory and wound healing capacity. Apart from these herbal drugs, certain formulations like Gugula Panchapala Churna, Triphala Gugula, Panchatikta Ghrita Gugula, Saptanga Bhugula, certain formulations are mentioned in Ayurveda which can be used for the treatment of Dushta Vrana. Apart from that, honey, topical use of the honey is also advocated, being antibacterial and having the wound healing capacity. Similarly, Grita is also indicated for Dushta Vrana. Yashada Bhasma. Yashada Bhasma is one of the traditional herbo-mineral Ayurvedic formulation that contains zinc. And we all know that zinc is required for the collagen synthesis, and collagen is one of the requirements for the wound healing. So, Yashata Bhasma can also be indicated in the cases of Dushta Vrana. Again, for the curing of chronic wunda, certain other things has also been done, like removal of non-viable tissues, autolytic debridement, enzymatic debridement, sharp wood debridement, etc. As well as control of moisture, because whenever there is a moisture, there is more chances for the wound to get putted. Here I have mentioned certain Ayurvedic formulation for the chronic wound like Gasisadi Grit, Jatyadi Tel, Tuthadi Lep, Mahavishkarva Lep, Jatyadi Gript. Now, coming on to the bed sore. In bed sore, what happens? You can see this picture. A person is lying down and certain pressure points are there. When for a long duration a person is incubated in the bed, in that condition, generally when the patient is long time he is bedridden, he is suffering from paraplegia, hemiplegia, etc. In those conditions, what happens due to the pressure point, the blood vessel in that area, there is a pinching of blood vessel, and ultimately this causes a friction of the skin against the surface. And what happens? In the first instance, there is a necrosis of the tissues. Due to tissue necrosis happens because of ischemia. Ischemia is loss of blood circulation, sudden blood vessel occlusion. After necrosis, what happens? There is the fibrin, the protein involved in the blood clotting forms at an ulcer site. Again, inflammatory response happens, and the inflammatory cells like neutrophil, lymphocyte and plasma cells comes to the point, to the place of the these region, these pressure points. It ultimately led to the abscess formation, and abscess formation is a result of the bacterial infection and inflammation. And finally, as this process goes on increasing, ultimately वहाँ पर वो area सड़ जाता है जिसको gangrene कहा जाता है. So, in Ayurveda, bed sore can be termed as Sajyavarn, considering its a clinical feature. Any kind of destruction or discontinuity of the body tissue, part of the body, is called a vrana, and for treating bed sores, Kapardika Bhasma, Yashada Bhasma with Jatyadi Grit has been indicated. Apart from that, Prakshalana. Prakshalana means cleaning with the Arakvadadi Kashai, and the application of the lepa like Jatyadi lepa is mentioned in the cases of pressure sore. Now, factors that increase the risk of pressure sores are age, and the person who are more thinner, and the person who having the very dry skin, less elastic skin. Apart from that, the person having the inability to feel the pain, the person having the neurological disorder, because they lost their senses to experience the pain. So they cannot tell you that they are experiencing something there, and meanwhile, because long duration over the bed, those area becomes are converted into bed sores. Poor nutrition, excess of moisture and dryness, bowel incontinence, and disease affecting blood flow, tissue damage, and lastly, Smoking, because smoking causes reduced blood flow and limits the flow of oxygen, leads to the risk factor for bed sores. Now, caring for the pressure sores. For stage 1 and 2 sores will often heal if cared carefully, but in the later stages, 3rd and 4th sores are harder to treat and may take a long time to heal. What has to be done? We have to relieve the pressure area. What we have to do is, we can use the pillows, foam cushions, booties or mattress bed to reduce the pressure. Some pads are water or air filled, which can be used to support, and next is to change the position often. The person who is bedridden, we have to keep on changing the position so that the areas which are succumb to those pressure points, they are relieved. In pressure sores, for the stage 1 sore, the washing of the area should be with the mild soap and the water, and for the second pressure sores, it should be cleaned with the salt water saline. The sore should be covered with the dressing so that it can be protected from the infection. Also, we have to avoid the injury or the friction. We have to avoid the slipping or sliding of the moving position, and care for the keeping healthy skin, clean skin and moisturized skin should be maintained. Check the skin for the pressure sores every day should be done, and if pressure sore changes or the new one forms, we have to tell to the person who is the health provider there. Lastly, Ayurveda formulation which can be used for bed sore, Sajjavan Chikitsa, we can use Gandhaka Rasayan, we can use Keshor Gugul, we can use Panchatikta Ghrita Gugul, we can use Jatyadi Tel, we can use Jatyadi Grit. We can wash the wound with the Triphala Kashai, we can do the dusting of the wound with the help of the Triphala Kashai. We can also use the borax, purified borax powder for dusting. So, by these methodology, the wound, simple wound, chronic wound and even the bed sore can be treated with the help of Ayurvedic modalities. What we can use is, we have to control the inflammation, we have to reduce the hyperkeratosis, we have to reduce the hyperplasia and maintain the melanin pigmentation in case of the acute condition. But in the chronic wound, our first and foremost aim should be to control the infection. Thank you.